UNICEF Australia is calling for greater vaccine access for low and middle income nations as the Omicron variant does spread in several countries. Joining me live now is the UNICEF Australia's Head of International Programs, Felicity Butler-Wever. Appreciate your time, Felicity. Do you expect that the emergence of this new variant will actually prompt the world to step up and vaccinate poorer nations? It's clearly in our own interest to do so.
Thanks for having me, Ash. Look, I hope so. If anything, this week should really highlight for us that the longer the pandemic goes on, the longer COVID is circulating in the community, the higher the risk that there will be mutations and we'll see these kind of variants emerging. And so vaccine equity is really at the front and forefront of our mind.
And what has led to such a delay in these poorer countries? Is it the cost? Is supply the problem? I see that various vaccine manufacturers have been suggesting that they do actually have plenty of vaccine to go around. Why aren't the vaccines getting into arms in the developing world?
Supply was a problem earlier in the year, obviously as wealthier countries were starting to try and access and had the funds to access the vaccines. The outbreak in India had an impact on supply because a lot of the expected supply was coming out of manufacturers in India. But we do now see an escalation in that supply, and what we really need is for those wealthier countries who have pledged to donate doses from their own supplies and funds to purchase supplies to live up to those pledges and to deliver those for the benefit of low and middle income countries.
And what about cultural issues? How central have they been to vaccine hesitancy? I know that in our region, for example, in Papua New Guinea, cultural barriers and suspicion of modern medicine have been very difficult to overcome, and a lot of aid groups are saying that that really needs to be a focus.
Yeah, vaccine hesitancy has been an issue in many countries, including high-income countries like Australia. It's been a big part of our work to combat misinformation and to get information that is accurate and helps people feel more assured of the vaccine to the places that we need it. But right now, I mean, the truth is across Africa and many Middle East countries, the demand for the vaccine far outstrips the supply, and we have the vast majority of people just waiting to be offered their first dose.
So in terms of what we're doing here in Australia, obviously there are calls for rich nations to help out their poorer counterparts. What have we committed to here in Australia, and are we delivering on those commitments?
Australia, the Australian government has been quite generous. It has made a number of commitments to particularly our region and has started delivering vaccines to a number of countries. We still have to fulfil those promises and get those vaccines out as quickly as possible. There's always more that can and should be done in terms of increasing our commitments to purchase vaccines. But beyond just purchasing the vaccines, it's the support for countries to be able to turn those vaccines into vaccinations and get them out to people in remote areas, and to ensure that there's support for other medical supplies, logistics, cold chain equipment, syringes, which will start to be a problem into next year. All of those things are needed. And yes, governments need to step up, including the Australian government. But it's not just government, it's also the private sector has a role to play, and businesses, paying forward. They've got a vested interest in ensuring that we can open up again and we bring this pandemic to an end. And of course, everyday Australians can also contribute by joining our Give the World a Shot campaign. Just a donation of just $5 is enough to provide 2 doses of a vaccine to somebody in a low or middle income country.
Felicity Butler-Wever, appreciate you joining us with your insights. Thank you.
Thanks for having me.